It's business as usual at Kapiolani Medical Center, even though nearly 600 union nurses are not allowed to return to work. Paul Drews follows up on the lockout and negotiations.
There won't be nurses picketing here at Kapiolani Medical Center this week, but they will be taking their message over this labor dispute to the streets. Instead of walking the picket lines, which they're not legally allowed to do without giving the hospital 10 days notice, they'll be walking the streets of Honolulu with a march from the state capitol to the headquarters of Hawaii Pacific Health. While they hope to attract more attention to this labor dispute, it has already caught the eye of Governor Green, who's a doctor himself.
I have so much respect and love for the nurses. I absolutely do. These are my colleagues and family, essentially. So I want a resolution. I also have a deep respect for the hospital system. You know, we are the health state. We have the best health indicators in the country, and it's because of the nurses and because of the hospitals. So my hope is that they will come together this week.
He has been asked by some to step in to end this labor dispute, but the governor cannot legally intervene in these private negotiations.
It's not the prerogative or the right of a governor to get involved in a private dispute. I am going to encourage them to settle and settle generously with the nurses, because I think they should be rewarded for their incredibly hard work and their overtime and so on. But I can't just step in. The reason for that is because it could be badly abused by some other governor.
Contract negotiations have dragged on for over a year and stalled before the strike. But now there's some good news. The Hawaii Nurses Association and Kapiolani Medical Center will return to the bargaining table this Thursday.
There are two issues that come up most regularly, one of which is staffing, the other is wages. And the union has not accepted our wage proposal. In fact, they keep asking for more money. And if it wasn't about money, the union would have already accepted our proposal.
Ruchetta says they have proposed a base pay between $133,000 and $160,000 a year in the third year of the contract. But the union has said they also cannot come to an agreement about safe staffing levels for patients. Even with hundreds of nurses locked out of work, Kapiolani Medical Center for Women and Children has not had to delay or cancel procedures for those patients because they brought in other non-union nurses temporarily.
We are providing uninterrupted care. All of our access is open. We're delivering babies. We have surgeries that are happening. Our emergency rooms are running, and we've had no disruptions for our families.
Paul Drews, Island News.